All right, we will get started. Welcome everyone to Where Germs Live, Session 1, Body Reservoirs. Before I introduce myself, I'd like to start by thanking you all for what you do for our patients in their community. My name is Lisa Ledoux. I joined Project First Line in May of 2022 as an infection prevention training liaison nurse. I will be presenting this short training with you today. I'm very happy to be here and I thank you for joining me. Before we begin, I would like to share a little background on myself. I come from a 30-year nursing background with a wide variety of experiences. I've worked in acute care, pediatrics, ER, clinical education, home care, and management. From my past experiences, it has allowed me to share and educate clinical and non-clinical healthcare staff. It goes without saying, the pandemic has impacted us all on many different levels. The one thing that we as healthcare workers have learned from it is that we need to stay vigilant when it comes to infection control. So that's enough about me. I would like to invite you to introduce yourselves in the chat box if you'd like to say who you are and where you're from. The Project First Line team is behind the scenes in support of this webinar with me today. Abby Anderson will be posting information for you throughout the webinar via chat. This session is brought to you by Project First Line Rhode Island under the CDC. Just a few reminders, everyone is muted at this time. There are 3 icons at the bottom of the Zoom app. There's a Q&A box. So if you have any questions, when we get to the Q&A session, we'll address them. There's a raise hand icon. If you'd like to use that as an option, when we get to the Q&A, we'll unmute you. And in the chat box, if you'd like to type your emails and be put on our distribution list for our emails, that'd be great. Or if you just want to say hi. So we will now begin training session 1, Where Germs Live, Body Reservoirs. Here's the agenda for today's presentation. We're going to go over the learning objectives, review the 4 body reservoirs. There will be a reflection, and the training will end with key takeaways. I will have a couple announcements to share with you, and then after the Q&A, we will end with the session feedback. So here are the learning objectives. After this session, you'll be able to describe 4 body reservoirs where germs live that are important for infection control and healthcare. Explain how germs can be spread from each body reservoir and cause harm. So what do you think? Here's a question I'd just like you to think about. You do not need to put any answers down if you don't like. But what part of the body or body system do you think is most likely to cause a risk for germs to spread in healthcare? I'm curious to see what your thoughts are now and if they'll remain the same or change after this session. The human body is full of reservoirs, places where germs live. You can see in this image that germs live on and in our bodies. When we think about how to keep germs from spreading in healthcare, it's helpful to think about where these germs live. If we recognize the body reservoirs and the pathways of infection, we will have a better understanding of infection control and how to prevent the spread of these germs. In this session, we're going to focus on the 4 reservoirs of the human body that are important for infection control. These are only a few examples where germs live, but today we're just going to focus on the 4: the skin, the gastrointestinal system, also known as the gut, the respiratory system, and the blood. This slide is a breakdown of key points. So as I discuss the 4 different reservoirs, I'm going to address each key point for each reservoir. So the first 3, key facts, special considerations, and common germs, those are pretty self-explanatory. But I'd like to dig a little deeper and explain more about the 4th one, the pathways of infection. There are 4 pathways of infection. The first pathway is touch, usually involves the skin, especially the hands, and it could be via handshake, touching an object, cell phone, door handle, medical devices. The second pathway, sprays and splashes. It could be from blood or body fluids or water from a sink. Germs in those splashes and sprays can get into the mucous membranes, the eyes, nose, and mouth, or even a break in the skin and cause infection. Another pathway is breathed in. It's exactly that, breathing in germs. So if somebody in close proximity coughs, there's a pathway right there for infection. And the 4th pathway is the breaking down of the body's defenses. This is not a new concept, but it's new wording. These infections can potentially be complications from a medical intervention. So what does that really mean? Think of how some medical procedures or interventions can provide a pathway for infection. It could be due to a failed aseptic technique, inserting an IV, bringing germs into the open skin, or a patient could become infected because a healthcare worker failed to wash their hands in between patients. The fifth key point that we're going to go over also today is the common healthcare actions. This follows kind of right behind what I just said with the last pathway. These are common tasks or clinical care that healthcare workers perform that involve these body reservoirs. So some of these actions or interventions can predispose the patient or the healthcare worker to infection. None of us have an intent to ever harm our patients, obviously. However, some of these actions we do can unintentionally harm them if we don't use proper technique or proper source control. And the last key point, number 6 here, is infection control actions. These are actions that we can do as healthcare workers to prevent the spread of healthcare-associated infections. How can I protect myself and my patients? We will start with the first body reservoir, the skin. Skin carries many germs and spreads them easily. Skin, especially the hands, interact with the environment daily. So many germs live and grow on healthy skin and normally do not cause harm. But some of these germs can be harmful to vulnerable patients. Think of all the things that we touch every day, whether it be in healthcare setting, a grocery store, at home, our office, our desk. We can carry and spread infection and not even know it. And most of these germs we don't see. So when one's hand touches a surface, germs can spread from those surfaces to that person and then onto others. Skin is a barrier. It serves as one of the best lines of defenses against harmful germs. However, skin is also a host to these germs. Broken skin, including dry, itchy skin, is likely to be more susceptible. It's open, and it could spread more easily throughout the body once they enter the body or bloodstream. Bacteria such as Staphylococcus aureus, including MRSA, or Streptococcus, or even Candida, which is a type of fungi that can grow as a yeast, can live harmlessly on many skin types. But if that skin is broken by a cut, a spider bite, or a bug bite, the bacteria or fungi can then enter the break in the skin, and it can cause an infection such as a cellulitis. So how can these germs spread? These are the pathways we're going to get into. Touch, that's one pathway. When one's hand touches surfaces, germs could spread from those surfaces to the person and to others. We perform tasks that involve taking a patient's pulse, bathing, assisting with ambulation or transfer. We're touching their skin, touching their body. Also a breakdown in the body's defenses. A procedure in healthcare that can push germs that are on the skin surface into the patient's body or bloodstream. An example of one of those devices would be a pulse oximetry. So if that device was not cleaned properly, and let's say the patient had a tiny cut on their finger, those germs that were not cleaned and disinfected can enter via that cut, that portal of entry now. In healthcare, we often do things that break the skin and predispose the patient to infection, such as putting in an IV. One task that healthcare workers performed and potentially can cause infection is IV insertion technique. I can recall in my clinical days, I'm seeing some healthcare workers go to insert an IV and they have their gloves on, but they then remove the tip of their pointer finger of their glove to palpate the vein. So if that healthcare worker did have germs, which they most likely could, have that germ on that fingertip, when they go to palpate the vein, they've now transferred that germ onto the patient's skin. So now when that IV needle enters the skin, the germ could be transferred directly right into the bloodstream. Other healthcare actions that we perform that can spread infection regarding the blood is drawing blood, administering injections, surgery, or any other invasive procedures. So how can you protect yourself and your patients? Cleaning hands. Hand hygiene is critical, and you're going to hear me say this and repeat it throughout this presentation. Keeping your skin healthy. You want to keep your skin clean, intact, moisturized, to prevent any dry, cracked areas to have that potential of infection to get in, especially with the winter months coming. Source control. If you have any cuts or scrapes, you want to keep those covered. Using PPE, gloves and gowns, cleaning and disinfecting surfaces and devices, and also perform safe injection and handling of sharps safely. Here's a poster that was brought to you by Project First Line of Rhode Island. It sums up all that we just reviewed regarding the skin reservoir. In this presentation, there will be a poster for each reservoir, so there'll be a total of 4 posters. Abby will be sharing the link with you, and these are all down. They're great. They're downloadable, and you can print them and you can post them in your facility, share them with your colleagues or your staff. Now we're going to review the GI system reservoir. The GI system or digestive system has 2 parts. It has an upper GI tract and a lower GI tract. The upper GI tract includes the esophagus, stomach, and part of the small intestine called the duodenum. And the lower GI tract, or the gut, has the small and large bowels, the rectum, and the anus. Most GI germs that cause infections come from the lower GI tract. They come from the gut. The intestines are filled with very large numbers of bacteria and yeast. Many of them are helpful and don't usually cause problems in healthy people. But under certain circumstances, it can be dangerous to those with weakened immune systems. Because these germs live in the intestines, they're in our stool. And these germs travel easily in stool from the gut to other places. They're commonly found outside the gut, including the environment, such as surfaces in the bathrooms, the toilet, the sink, the stall door handles. So some common gut germs, just a few here, the E. coli, C. diff, salmonella. Again, these germs can be in many GI tracts and not cause any issues. So let's just review E. coli for one of them. There are a few types of E. coli. Most common cause of E. coli is from eating contaminated foods such as beef, unpasteurized milk, produce, uncooked flour. So as I was putting together this presentation, I reflected on some clinical experiences I've had. I'm sure a lot of you have many. So this one story of E. coli popped into my mind. Years back, there was a 16-year-old girl that presented to the ER with bloody diarrhea, vomiting, severe abdominal cramping. She was a very sick young lady. Upon review of her health history and also what she ate in the past few days, she secretly confided in me. She didn't want her mom to know that she ate a lot of raw cookie dough. And she had that about 4 days prior to her coming to the ER. First thought was possibly this could be salmonella. She was admitted, and later they found that she did have a type of E. coli. The symptoms of certain E. coli, as some of us know, it can appear 3 to 5 days after ingesting that contaminated food. And although we may not think of flour as a raw ingredient, it still needs to be cooked prior to consumption. These common GI germs can spread through 3 different pathways: touch, by skin, with our hands. Once someone has consumed contaminated food or water, this infection can be passed from person to person by hand-mouth contact. The germs in stool can easily spread also onto your hands and skin, and then spread onto other parts of the body or to the environment, as we just mentioned in the bathroom. Splashes and sprays from toilets. An example, you want to be very careful if you're emptying out a bedpan or a commode. Breaking down or bypassing the body's defenses, another way of infection to spread through a colonoscopy. Some interventions that are performed in healthcare that involves the GI system and stool or toileting a patient. For some of you PD nurses out there, changing a baby soiled diaper, bathing a patient, handling bedding and linens, towels. So if a patient, let's say, has C. diff. C. diff patients, as some of you know, can be very ill and usually incontinent of large amounts of stool. They don't have control over their bowels. Healthcare workers should remove those linens from the bed or the stretcher very carefully to ensure that the bedding is rolled up to avoid any of that stool from escaping. Keep soiled linens away from your body when you're going to put them into the soiled linen bin. Some patients with C. diff, they require a rectal tube or a rectal containment bag for a few purposes: to contain that infectious stool, to allow that patient more comfort, and also prevent skin breakdown. So how can you as healthcare workers prevent the spread of these gut germs? Hand hygiene, using personal protective equipment, such as your gloves, gowns, face shields when emptying the bedpans or commodes. Cleaning and disinfecting surfaces and devices, bed rails. Handling linens carefully. Again, like I mentioned, you want to keep all infectious waste and material away from your body. Managing trash and waste appropriately. We want to always monitor and make sure that that trash is not overflowing with infectious waste that's exposed and that can now predispose and put somebody else at risk for infection. And here is another poster, a summary of all that we just reviewed on the germs that live in the gut. Again, feel free to download and print. And now we're going on to the respiratory system. The respiratory system consists of the upper and lower airway. The upper airway includes our nose, our throat, and our windpipe. The lower airway includes the lungs. Many germs that live in the upper airway, germs in the nose and mouth can easily be spread to the skin and hands when you touch your face. And then from there, then you touch a surface and it can go to other people. The defenses of our nose, mouth, and throat keep a lot of germs from getting into our lungs. And most of the germs are commonly found in the upper respiratory system. They keep that part of the body healthy. But when those germs get past the defense of our nose, our mouth, and our throat and travel to our lungs, now we could be looking at a lung infection. And one of the lungs' defenses is to cough. We want to get those germs out, so we're going to cough. However, coughing now is another pathway of means of transmitting the infection to someone else. And some common germs that are found in the respiratory system, they can include Pseudomonas, Staphylococcus aureus, which includes MRSA, viruses such as RSV, influenza, and of course, we all know the SARS-CoV-2. Let's say Pseudomonas gets past the defenses of your nose, mouth, and throat, and then goes into your lungs and now causes a pneumonia. For many people, Pseudomonas infections will cause mild symptoms. However, it can be severe and life-threatening in people with weakened immune systems. And Pseudomonas is one of the most common pathogen of ventilator-associated pneumonias, VAP. It's highly contagious. And some of these Pseudomonas or staph can be spread by a few different pathways, breathing in those germs that are in the respiratory droplet or in the air. When an infected person talks, breathes, sneezes, or coughs, they produce respiratory droplets that could spread germs. Splashes and sprays, they can get into your eyes, nose, and mouth. Touch, germs, again, in the nose and mouth could be spread to the skin via hands when they touch their face, and then it could spread to the surfaces and obviously another person. An example, I mean, we've seen this so many times. You could see somebody that's coughing, or you might not see that person coughing, and then they go and touch a doorknob or they touch an elevator button. There's always someone next to touch that same infected object. And here are some of the healthcare interventions involving the respiratory system that increase the risk of healthcare associated infections. Performing oral care, toothbrushing, denture care, using CPAP for patients who have sleep apnea, intubating a patient, administering medications via nebulizer, and respiratory virus testing for COVID, influenza, RSV. So some infection control actions that you can take to prevent the spread of respiratory droplets is maintaining respiratory hygiene and cough etiquette, coughing into your elbow, cleaning your hands, properly disposing of tissues, and then followed by hand hygiene. For source control, you want to wear a mask that covers snugly over your nose and your mouth. Ensuring good ventilation, germs are more likely to spread in places with poor ventilation or if there's a large group of people around. Here are some more infection control actions that we can take. Maintaining physical separation in a common area. So if somebody comes in and they're very ill with a respiratory illness, can they possibly be placed into a single room? Using PPE, respirators and gowns. Cleaning and disinfecting objects such as bedside tables, cell phones. Also your bedside or your exam room computers, those, the keyboards. And here is our third poster on the summary of all that we just reviewed on germs that live in the respiratory system. We're now going to review our last reservoir, the blood. Blood is sterile and it's not supposed to have germs in it. Some viruses can cause infections that last for a long time and release virus into the blood. That blood can then spread the virus to other people if untreated. In a couple of slides, we're going to review some examples of some organisms that cause infection in the blood. And blood also is a very good place for germs to grow. It is nutritious food for bacteria. Did you know that scientists use blood to grow bacteria in the lab because it's good food for germs? So if you see blood outside of the body, you could pretty much assume, I don't like to say the word assume, but that germs are growing in it. So if blood gets on germs in the environment, like on linens or a device, those germs are likely to grow, multiply, and can spread. Viruses like HIV, hepatitis B, hepatitis C can spread in healthcare when contaminated blood, for instance, on a sharp item, let's say. So how can these germs spread in the blood? Touch. If there's a blood droplet on linens or a device, bacteria will grow and spread via touch or a device. A glucometer, for example, if a blood droplet was left on a glucometer, it wasn't cleaned properly, it could become a breeding ground for germs. Splashes and sprays, again, are a pathway for blood infections to spread. And breaking down our own body's defenses, which we're going to review in the next slide. These tasks that involve blood: inserting an IV, performing surgeries and procedures, changing soiled laundry, administering an injection. So if administering an injection and the patient has a virus such as HIV, Hep B, or Hep C, and there is an accidental needle stick, germs can then spread to the healthcare worker and cause a new infection. The needle stick incidents have come down, which is wonderful, but they are still happening. We do now have safety devices on these needles, such as resheathing devices or retractable needles that allow the healthcare worker to avoid recapping. If the healthcare worker uses properly, they will protect themselves from an accidental needle stick and potential infection. So it's really critical and important that these safety devices do not get modified. Some infection control actions that can help stop the spread of germs from blood include performing safe injections and handling sharps, as we just said, safely. Using PPE like gowns, gloves, and eye protection. Hand hygiene, handling linens carefully, cleaning and disinfecting objects. And here is our last poster on germs that live in the blood. So these are great posters. They really sum up everything that we just broke down on each reservoir. So before we end this session and go over our key takeaways of the presentation, I'd like to have you all reflect on what we reviewed today. If you'd like to share and put your answers in the chat box, that'd be great. Now that you have some knowledge on the 4 body reservoirs, if you were to focus on one reservoir that stands out in your line of work, which reservoir would it be and why? I'll give you a few moments if anybody would like to add on chat there. Okay, so moving on. Thank you so much for that. Moving on to the key takeaways. Reservoirs are places in and on our bodies where germs live. Germs frequently spread between and among these reservoirs. 4 reservoirs in the body that are important for infection control are what we reviewed: the skin, the gut, the respiratory system, and the blood. Recognizing where these germs live is the first step in understanding how to stop their spread and protect patients. So this ends the learning portion of the presentation. Before we move into the Q&A session, I just have a few announcements to share. The certificate of training will be emailed in a PDF form after the post-session survey closes. And that survey closes a week from today on October 24th. Post-session survey will be emailed to you tomorrow, and post-training resources and a copy of this PowerPoint will be sometime this afternoon. You can also follow Project First Line on social media. We're on Twitter, Facebook, Instagram. Project First Line has some exciting future training sessions coming up. Next Monday, October 24th at noontime, 12 to 12:30. I will be the lead trainer in that again, and we're going to go over Where Germs Live, Session 2, Healthcare Environmental Reservoirs. All right, thank you. Take care, everyone.